first tooth comes in, we should start to brush it. Sometimes it's hard with, obviously behavior dependent, and depending on breastfeeding schedule, sometimes it could be tough. I'll say if you really have trouble brushing when first teeth are coming in, at least wiping with the washcloth really helps, especially after breastfeeding. Breast milk itself actually is not carcinogenic, meaning it will not cause cavities. But once you combine breast milk with regular diet, that's when the oral microbiome kind of becomes complex and it could start to cause cavities in the mouth. So whenever you breastfeed, wipe it with the cloth afterwards. If you are unable to brush, if we're falling asleep, at least wiping that top layer of sugar could be really helpful. And as we get older, as we get more teeth, brushing twice a day is usually recommended. Being, the most important time to brush is really at nighttime, because we went through a whole day of eating, drinking, and doing a lot of stuff throughout the day. We don't really want to leave all that stuff on the teeth as we go to bed, because a lot of our protective reflexes as we sleep are not as active as during the day. Our salivary flow is lower, and we're not constantly kind of changing our saliva in our mouth when we're sleeping. And sometimes if we sleep with our mouth open, it's also dry, so saliva is not as protective as it should be during the day. So it's really important to brush at night before going to bed. And another thing to know is after we brush and do our nighttime routine, nothing to eat or drink afterwards, because then it, defeats the whole purpose, because we just establish a clean environment and we want to protect that for the nighttime.